Hi, I'm Kristen, registered nurse with the UR Medicine Home Infusion Pharmacy, here to tell you today how to disconnect your chemo when the infusion is complete. First, you want to make sure that it's been connected to you for the full time frame that it's ordered. Next, you want to make sure that you have a clean work surface, so you can clean with a sanitizing wipe, a disinfectant wipe, a spray cleaner, and a paper towel or soap and water. Then you want to wash your hands with soap and water and dry with a paper towel, or you can use alcohol-based hand gel. Next, you want to get out your supplies. You should have a chemo disconnect kit like this. You need 2 saline flushes and then 1 yellow heparin flush. You want to make sure that you put on your chemo gloves before you touch the chemo ball. Open up your kit. There are 2 pair in here, so you should have more than enough. And you're just going to put on 1 pair. You want to make sure that it looks like this and it's completely empty. That inner layer should be completely deflated against the center core. Then you want to close your clamps. You have 1 on your medication tubing, and then you may have 1 or 2 on your needle tubing. Okay. Then you're going to remove the flow restrictor that's taped against the body. This is the place where you're going to disconnect between. You're going to look for this thicker piece that has a blue band around the end. And then you're going to disconnect. And this is going to go right in your waste bucket. You can open up all your flush packaging. Also in your kit, you'll have all the alcohol pads that you need. There's also a piece of gauze and a tegaderm. You can set that aside for in case we need it at the end. Okay, you're going to take one of your alcohol pads. We're always going to clean each time we connect to the port needle. And you're going to clean for 15 seconds. I just have the pad wrapped around the end and I'm rubbing from side to side and the flat part on top. While that's drying, you're going to take your flush and twist the cap and remove it. Once we take the cap off, we don't want to touch the end of the syringe under the cap. There's a little air bubble, so you're going to pull down on the plunger to break the seal and then slowly push up to get the air out till you see a little fluid come out the tip of the syringe. Then you're going to push and twist the syringe to lock it on the end. You're going to open up your clamp and you're going to flush with a push stop motion. You're going to close your clamp and disconnect your syringe, put it in the bucket, and you're going to clean with another alcohol pad. And we're going to clean for the same 15 seconds. And we're going to do the same thing with the second flush. Remove the cap, pull down to break the seal, push up to get the air out till we see a drop. And we're going to push and twist the syringe on there, open up our clamp, and flush with a push pause pulsing motion. Close your clamp. Take your syringe off, put it in a bucket, and we're going to do our heparin last. This is what we want sitting in the port tubing when the needle is removed. We're going to clean again with 15 seconds. And we're going to take the cap off the heparin, pull down, push up to get the air bubble out. Make sure we see a little drop of fluid come out the top. And then you're going to push and twist them together. Open up your clamp. Push the heparin in, pulsing it. Close your clamp. And then take off your syringe. Okay, so now we're done flushing the port, and we can remove the dressing and take the needle out. So sometimes you may have a special pad underneath the needle, which I'll show you once we take the dressing off and we remove the needle. So first you're going to just carefully peel it up. You can use a mirror to look at it if you need help seeing it. Okay, just going to peel that off. Just want to make sure all of the dressing is removed from the skin. It may not come completely free from the tubing, but it's okay as long as it's not touching the skin. Next, you're going to fold up your yellow wings with your dominant hand, and you're going to use your non-dominant hand to push down against the clear tabs. So you're going to push against the chest while you're pulling out on the yellow tabs with your dominant hand. 1, 2, 3. Once you hear the click, you'll know that the needle's completely out. There is the safety cover that should cover the tip of the needle so you don't stick yourself. This can go in the bucket. Some of you may have a special antimicrobial patch that's left. You're going to just find where the tabs are and slowly lift up and remove that. If you have any trouble removing it, you can use one of the alcohol pads to kind of help remove it like this, okay? But it should lift up pretty easily. And that can go in your bucket. All right. Usually there's no bleeding, but you may see a drop of blood, and that is normal. You're just going to take your gauze from your packet and apply pressure for a minute until the bleeding stops. You can also cover it with the dressing provided. You'll just want to remove that before you take a shower, or once you take a shower. Okay. All right. When you're done, you should remove your gloves by folding them inside each other and then putting them into the bucket. The lid goes over the bucket, and you can store this away from kids or pets up on a shelf or out in the garage. And you're going to keep it in the home until it's full. When it's full, you're going to use the box that it came in. It has a postage paid label on there. There's instructions in the box, and you can mail it back. Just request a new one from the pharmacy when you need a new one. If you have any questions about how your disconnect is going or how you're feeling, you're going to call your doctor's office. Thank you.